So, what makes a community truly healthy? Is it just about having enough hospitals and clinics? Today, we're going to dive into the Columbia Gorge region, which is this really unique area that sits right on the border of Oregon and Washington. We're going to explore how they figure out how well their community is doing and how they're tackling some of their biggest challenges. It's a story that reveals two very different approaches: the official, structured systems, and the incredible power of grassroots community connection.
To really get what's happening in the Gorge, you have to start right here with this quote. This came directly from people in the community during listening sessions for a big health report. And notice what it's all about. It's not hospital beds, it's not insurance rates, it's connection. This idea that social support is the absolute bedrock of health, that's the main thread we're going to follow through this whole thing. Okay, so if social connection is the ultimate goal, what's getting in the way? Before we can understand the solutions that people are trying to build, we first need a really clear, data-driven picture of the challenges the community is up against. And that's exactly what this big health assessment gives us.
So who put this report together? It's a group called the Gorge Collaborative. And this isn't just one hospital's opinion. It's a whole partnership of the key health organizations in the region. Their goal isn't just to treat people when they get sick. It's to actually build a stronger foundation for better health and fairness for everyone who lives there.
And you can see this is a region that's, well, it's changing. While some counties are growing at a pretty steady pace, look at Klickitat County in Washington, a 13.5% jump in just over a decade. Now that kind of growth can bring new energy for sure, but it also puts a ton of pressure on things like housing and healthcare, which really sets the stage for some of the challenges we're about to see.
So the health report really zeroed in on a few key challenges. But here's the most important part. None of them exists on their own. They're all deeply and often painfully tangled up together. Let's take a look at how money problems, the housing crisis, and behavioral health are all connected.
This quote from someone in the community just nails it. Economic insecurity isn't just another issue on a list. It's the starting point. It's the first domino that falls and creates this cascading impact that ripples through every single part of a person's life and their health.
Now, this data on housing is really telling. Yeah, a majority, about 69%, feels secure. But you can't just ignore the rest. Nearly 1 in 5 people who have a place to live are still worried about losing it. And then you have 13% who are actively insecure. Couch surfing, in shelters, or even living in their cars. That is a huge amount of stress just constantly simmering in the background.
And this right here, this puts a human face on those numbers. It perfectly captures the frustration. For some people, it's not that there's a lack of houses, it's a lack of available homes. Just imagine that. You're struggling to find a place for your family, and you're literally surrounded by empty vacation homes that are just sitting there. It really connects the data to a very real, very frustrating experience.
And that economic cascade just keeps on falling. You've got nearly 1 in 5 people worried about being able to afford food. But check out the number for childcare. Over a third of families who need it are struggling to find it or pay for it. I mean, think about that. These aren't separate problems. They are competing crises, all fighting for the same few dollars in a family's budget.
All of this stress, from housing, from food, from childcare, it has to go somewhere. And a lot of the time, it ends up here. This is data from a local hospital, showing why people are coming to the emergency room for behavioral health issues. And while anxiety is definitely up there, look what's at number 1. Disorders related to substance use, like addiction to alcohol or drugs. This is the crisis point where all those other problems often boil over. And it leads us right to the question of how the system tries to help.
So when someone hits that crisis point and needs help with a substance use disorder, what does that path actually look like? Now we're going to shift gears and explore Oregon's official framework, the very structured, rule-based system that's in place to govern treatment. It's a pretty big question, right? It can feel a little overwhelming to look at official documents, but we're going to break down just a few of the key ideas that make up the backbone of Oregon's formal treatment system. So the foundation for all of this is something called the Oregon Administrative Rules, specifically Chapter 309, Division 18. You can just think of it as the official rulebook. Its whole purpose is to make sure that any licensed treatment center is meeting certain minimum standards for safety, for the quality of their care, and for how effective they are. But just having a rulebook isn't enough. How do you make sure you're making consistent, fair decisions for each person? Well, that's where a really important tool called the ASAM criteria comes in. ASAM stands for the American Society of Addiction Medicine, and their criteria aren't a rigid checklist, but more of a clinical guide to help professionals make smart, patient-centered decisions. It's all about getting the right person, the right kind of care, at the right time.
And the way the ASAM criteria are organized is through these levels of care.
You can think of it like different levels of intensity. The system is designed to match the intensity of the treatment to the intensity of the patient's needs. So, for example, someone with really severe unstable medical problems might need level 3.7. That means intensive inpatient care with doctors and nurses around 24/7. But someone else who's more stable but still needs a really structured place to be might be a better fit for level 3.3.
Now here's where the formal system recognizes something deeply human. Even inside this very clinical, rule-based world, there's an officially recognized role for someone with lived experience, the peer support specialist. And this is a really powerful thing. It's the system itself saying that one of the most important parts of getting better is being able to connect with someone who has actually walked in your shoes.
That idea of shared experience is actually the perfect bridge to a completely different kind of approach. So now we're going to shift away from the world of administrative rules and clinical criteria, and we're going to look at a grassroots effort that's taking shape in the Dalles, which is one of the main communities in the Gorge. This question from Derek Greenwood just gets right to the heart of it all. Yeah, those formal support meetings are crucial, but recovery is a 24/7 process. He's pointing to those huge empty gaps in a person's day. The vulnerable hours where connection isn't just nice to have, it's absolutely necessary.
So what's the answer to filling those empty hours? A recovery clubhouse. Now, it's really important to understand that this is not a clinic or a medical facility. The goal here isn't treatment, it's social. It's about building a safe network, finding positive role models, and simply having a place to go to connect with other people who are on a similar journey.
And this is what that looks like in the real world. We're talking about practical help, like financial workshops, but also just life. Things like group hikes, barbecues, just getting together for coffee. These are the normal, healthy social activities that are so important for building a new life in recovery, but they can be incredibly hard to find on your own.
And for the founder, Derek Greenwood, this is deeply personal. A center just like this one is what helped him turn his own life around. The friendships he made and the activities he got involved in were what helped him stay sober. And now, at 56, he's trying to build that same lifeline for other people in his community. It's just a powerful testament to how well this model can work. So, we've looked at two very different models here. One is top-down, clinical, and built on rules. The other is bottoms-up, social, and built on relationships. The real path forward for a healthy community, well, it's probably going to need both. And this chart lays the two paths out right next to each other. On one hand, you have the system. It's structured, clinical, and guided by professional tools like the ASAM criteria. On the other hand, you have the community. It's social, it's grassroots, and it's powered by the lived experience of peers. The big takeaway here is that they're not in competition with each other. They're just serving different but equally vital needs on the long road to recovery. And that leaves us with this one last thought. A truly healthy community probably can't be built on rules alone, and it probably can't thrive on relationships without any structure. The real challenge and the biggest opportunity seems to be in finding that perfect balance, where the structured systems can support and empower the human connections that are, as we saw at the very beginning, the foundation of everything.